Are you a parent wondering if you're doing right by your kids?
A therapist seeking real-world applications for working with children and their families?
A teacher trying to navigate educating the whole child in today's world?
Then this is the podcast for you.
Hey guys, it's Brigid
And Jenna.
the teacher.
And the therapist.
Alrighty, Miss Jenna.
Do you know what number it is?
13?
Lucky number 13.
Oh, man. My mom always said 13 was her lucky number because she was born on the 13th. I think it was even Friday the 13th.
Interesting.
Yeah.
What month? Not October.
August.
I knew somebody born Friday, October 13th.
Wow, that's intense.
I know.
I keep seeing this thing going around on Facebook that says Halloween this year is the first time in like 50 years that Halloween falls on October the 13th or Friday the 13th. And I was like,
That's incorrect.
that's not how Halloween
It's
works.
actually always on the 31st.
So I'm like thinking
That's
maybe
weird.
that it's meant to say like that there's a Friday the 13th in
In
October.
October.
But like so many people keep sharing this and I'm like, you guys, like is this a joke that
Right.
I'm not a part of?
Right.
Like
Are you dumb?
I know.
Or are you being ironic?
are you dumb or am I dumb?
Right.
Because one of us here is dumb.
Who's dumb? Please give us an intelligence test.
Oh man.
I love that. Okay. Well, what are we
Anyway.
talking about today?
Oh, I am really excited for today's episode. We are going to chat about anxiety
I
in
love
children.
it. I gotta love anxiety.
Yeah.
You gotta love it.
And this is something that, like, between my own personal childhood experiences,
Mm-hmm.
my children at my home,
Mm-hmm.
the students in my classroom,
Yeah.
I have seen anxiety present in so many ways. So I really can't wait to kind of dive in and see what it looks like and see what we adults can do about it.
Definitely. Anxiety is something that I see a lot. Maybe that might be like the number one thing I see in children in my office. So I'm also very excited to talk about it.
It's very common, I think.
Yeah.
So this is, once again, Jenna, kind of going to be your area since anxiety and emotions are big. So,
You have lived experience with the kids in your life.
but can you
Yeah.
start by telling us, like, I guess just how common it is
Yeah.
and what we're looking out for when we're seeing it?
Yeah. So there are actually 11 different like diagnosable anxiety disorders. And then
Wow.
I know all of which, well, yes, all of which children could be diagnosed with. Some would
I
be
always thought it was just
more rare.
generalized anxiety disorder.
No,
There's more.
11 of them.
Wow. Can you tell us some of them?
Yeah, absolutely. So generalized anxiety disorder is one.
Right.
I believe the whole list is on our Instagram in case I don't get all 11. But generalized anxiety disorder or GAD. Then there's phobias. So like if they're afraid
Okay.
of the water or whatever. There's separation anxiety, which we see a lot. I'm sure potentially you see a lot.
Absolutely. That's a big one.
Yeah. Then we have social anxiety, which presents a little bit differently.
Okay.
Than
Okay.
separation. It's more in social situations, which we would often see probably diagnosed more in our older like kids.
Mhm.
Separation anxiety from like primary caregivers would be usually younger, sometimes older. And then there's like unspecified, like just kind of like the catch-all.
Gotcha.
If you don't meet criteria for something else. There's substance induced, which
Oh.
could be from like, illegal substances that you might see in like an adult or a teenager. However, it can also be medication.
Okay.
So there have been times, right, that like there maybe, for example, the child is given a stimulant for ADHD or something like that, and they have an anxious reaction to it. Then sometimes, often you see it in a medical setting that they're diagnosed with that, which is kind of like the prescriber's way of saying like, oh, remember they had this reaction, and it communicates to other prescribers. Oh, hey, they had like anxiety induced by a substance.
So avoid
Don't
that.
give them stimulants, right?
Okay.
Or they might even put that in it of like, from XYZ medication.
But
That makes
this
sense.
is also possible, like, from use of, like, marijuana
Correct.
or
Yeah.
street drugs,
Which
too.
that you would see, hopefully not in young kids, but maybe
Right.
teenagers, adults.
young adults.
Yes, absolutely. Yeah, it can be
Okay.
from,
So it could be from either.
yeah,
That's interesting that
Mhm.
that those drug uses,
yeah,
even legal or illegal, can cause anxiety responses. I wouldn't have thought that.
Yeah, it is interesting because I actually kind of learned that because I saw it in one of my clients' charts at an old job, and I was like, wait, what?
Yeah.
And then the prescriber explained it to me that they had like a reaction. So I don't know, I got to number 5, I think. One is selective mutism. That might be one that you don't hear of.
Interesting. That's an anxiety disorder.
Yeah, it's considered an anxiety disorder.
I actually hear about that a lot in the classroom, specifically with kids that are on the spectrum and things.
Oh,
but
sure.
I never heard of it. I guess I didn't know it was an anxiety disorder.
Yes, it is.
It always kind of just seemed like
it's usually based in some sort of anxiety.
It makes sense if you really sit down and think about it.
Yeah.
What about, we talked about PTSD. Is that considered an anxiety or is that separate?
It's separate. It's technically under like trauma and related disorders.
Okay.
That's like the chapter in the DSM. It's like adjustment disorders, acute stress disorder, PTSD, things like that.
Okay.
You also, with anxiety, you have like panic disorder. So panic attacks, and specifically then the fear of having another panic attack.
Oh, yeah.
That's like an important piece of panic disorder because you can have, for example, like social anxiety with panic attacks. You can have PTSD with panic attacks. So it has to be kind of more than just like the panic attack itself.
Okay.
That's not a disorder. Agoraphobia, which...
That's the one where you don't want to leave the house, right?
Yeah.
I think that's the very basic understanding of it.
Yeah. House or like area. So like I know people who it's like they can go within a 10-mile radius of their house. They could stay in their hometown, but once and I've seen it happen, right? Where they're literally on the highway, they're fine. They cross like a county line and it's instant.
Yeah,
it's very, very real. So yeah, those are the big ones. I don't think I got all, like I said, there's unspecified and other specified and some kind of weird ones. But yeah, so actually we were saying it's pretty common, right? So according to the CDC, about 10% of ages 3 to 17 were diagnosed with anxiety from 2016 to 2019. And then that number doubled to over 20%, like of clinical level symptoms from 2020 to 2021, which
are we shocked?
Yeah, I don't think any of us are surprised about that one. And that's just who is diagnosed, right?
Right.
That's just people who got services maybe through their primary care doctor or online therapy. You know, a lot of therapists weren't in person. And so I would imagine that young children, it was probably hard to even get that diagnosis at the time.
And I think we definitely know that many, many children are suffering from probably what is a clinically diagnosable level of anxiety, but are not being seen or diagnosed with that.
Right. And that's 20% that we know of during these 2 years. So, yeah. So, and I think I mentioned it's probably the most common thing I see in my office, but it might not be like on the surface level. Parents, guardians might bring in the kid because they're being disruptive in the classroom. They're having aggressive behaviors. They're refusing to go to school. But really oftentimes like anxiety is underneath that, underneath like this defiant behavior that, you know, people say. So
I think a lot of the times what we label as misbehavior in children, well, no, not a lot of the times, all the time, there is an underlying reason.
Yeah.
And a lot of the time that underlying reason is an anxiety of some type.
Yeah.
It's a fear or a worry or
whether it's diagnosable clinical level or not.
Correct.
Yeah. So
I mean, it's normal to worry about things.
Yeah.
As
absolutely.
adults, we worry about things. As children, we think, oh, they have nothing to worry about, but they do. They have lots. Yeah. So
yeah, I think about the kids right now who are in the South, who are in, you know, Western Florida, who are in North Carolina, and the things that they've witnessed, that's going to induce a lot of anxiety.
Oh, absolutely.
You know? I think I know we both love Full House. So any of our listeners that like Full House, there was an episode where there was an earthquake and Danny wasn't home.
Oh, yeah.
And Stephanie
struggled
with it, right? That there was going to be another one and that he wasn't home. And she actually went to a therapist and they did a drawing. And so I always like that depiction. But yeah, which makes so much sense, right? That might be when you see separation anxiety coming up or something like that.
So my understanding is there are different ways that we're going to get those diagnoses of whichever anxiety we have.
Right.
Can you tell us a little bit about these different methods that you use to diagnose.
Yeah. So there's something called the SCARED because we love
Scared.
yes, we love like funny acronyms in the counseling world.
You therapists.
So there's a child version and a parent version, but it stands for Screening for Child Anxiety Related Disorders. Kind of a mouthful, but
that's why they call it scared.
that's why they call it SCARED. And this helps differentiate not just like yes or no anxiety, but which anxiety disorder it may be.
I think I looked through this and some of them are like that the parent fills out as like, my child has a hard time separating from me.
Yeah.
As opposed to my child is fearful of school and interacting with friends, or my child is afraid of bugs and has an overreaction to bugs.
Right.
So yeah, it definitely seems like it's looking for all those different diagnoses that you were talking about.
Yeah, exactly. So like I worry about things not working out for me. When I get frightened, I sweat a lot. I am a worrier. I feel dizzy. So some it's like, is it like somatic? You know, are they having nightmares? So that might even help us pinpoint a little bit more about like, is it a trauma related disorder? Things like that. Not necessarily, but it could.
Is this one, this question says, when I get frightened, I feel like passing out.
Yeah.
Is that looking for like a panic disorder, or is that just looking for a physical response to the anxiety?
It could be. It could be like a somatization disorder, meaning like it's kids feel things very physically in their bodies. A lot of times I'll get referrals from pediatricians and primary care doctors where it's like they're getting belly aches and they've done all the tests and it's nothing, or they're getting headaches. We see that a lot in school-aged kids. So it could be something like that. They're somaticizing their symptoms.
Gotcha.
It could also be like a panic attack. And so there's actually, it's the way you answer it is like not true or hardly ever true, somewhat true or sometimes true, or very often true. And that's like 0, 1, or 2. And then that's how you score it. So you go to the bottom and if you get like, it kind of shows you like on question 1, if you answered, you know, with either a 1 or a 2, then it could be under these things. And if you on question 2, so then you match it up like, okay, so it could be these 4. And then, but I also answered yes on question 2. So that eliminates school avoidance, right? And so now I'm kind of going down and it's like, which one is the most common or most likely? So
it helps you fit with which one it is.
Exactly. So it says over 25. It might indicate some sort of anxiety disorder, and then scores over 30 might be more like specific. And then it tells you if you got a score of at least 7 on A, B, and C, like answers or questions, it could be panic disorder or it could be whatever it is. And so, yeah, I could kind of look at both of those.
So if you think your child has anxiety, where would you go to get this screening? Would you go to the pediatrician or straight to a mental health facility?
You could definitely go to the pediatrician. I always say like that's a great first place to start. And I don't know if there's an age on this specifically, but there is one for younger kids too, the preschool anxiety scale, which isn't as cool. It's just the PASS. It's not scared, but and that one's just parent report because they're going to be real little.
Younger, yeah.
But same thing. Are they tense, restless, irritable due to worrying, difficulty stopping themselves from worrying, afraid of closed-in or crowded places? So that could be more agoraphobic type of thing, or social anxiety. Yeah.
How do we know? Because I can look at these and say, like, is scared of thunderstorms.
Sure.
Is afraid of talking in front of the class. Is afraid of unfamiliar people. And, you know, my kids meet all of these.
Sure.
How do we know when this is something to take seriously versus all children are afraid of these things? That's normal.
Yeah, absolutely. Yeah, I mean, when it comes down to it, it's like distress. I think I may have said this in another episode. When it comes down to it, it's how like impairing it is. So is it distressing to the person? Is it impairing their school or work abilities? Is it disrupting things like eating and sleeping? Is it affecting relationships? Right? So if you are so anxious about taking a test or so anxious about speaking in front of the class that you don't go to school for a week, that's a problem.
Right.
You know, that's more than just, hey, maybe I gotta, practice this a lot and I'm going to practice in front of my aunts and my uncles and my neighbors this weekend because on Monday I have to give a presentation.
Right.
And yeah, of course you're going to feel a little
nervous. Yes.
Yeah. But if it's, I'm not going to school because I can't leave my mom's side.
Right.
And it's not just, or it's going on and on and on all day long, every single day.
Okay.
And it's not just you have a tearful kid at drop off and then
they're okay.
Grown-ups leave and they find a friend and they can move on with their day.
Oh, yeah, we see that all the time.
Sure. But if they're standing by the door and crying for every day, all day, for a week straight, you know.
Okay, so I'm going to age myself, but I grew up watching the Princess Diaries movies.
I love the Princess Diaries.
But you know the part where Mia has to give her debate?
Yes.
And she throws up and runs away, right?
Yeah.
So this is what we can consider like an anxiety reaction versus just a nervous reaction, right?
Yeah, I would say if it's something like that.
That's causing that like physical reaction and she's having to run from the situation.
Yeah. Yep.
Okay.
Definitely.
All right.
So how do you see anxiety show up like in the kids in your life, in the classroom? Like what is your personal experience?
I will say somatic responses, that physical response.
The belly aches.
Is the biggest one, I think.
Yeah.
My tummy hurts. My head hurts.
Mm-hmm.
I don't feel good.
Mm-hmm.
And I think that they don't. I think maybe they're feeling it, you know, when you feel sad or worried, you kind of feel that in your chest, in your heart, you know.
The pit of my stomach type of thing.
And so I think they're feeling it and they don't know how to differentiate between those things.
Yeah, absolutely. That's like how kids, like that's what, they often have that language before they have like, I'm scared, unless they're given that language. So it might just be my belly hurts or that's their way of saying, I don't want to go to school today. Or that's their way of saying like, oh yeah, I have butterflies in my stomach.
Yeah.
A 3-year-old's not going to know probably what that means.
I have a student who faced a lot of anxiety over many things in the classroom. And every time their response to this anxiety is, I miss my dad. I miss my mom.
Okay.
And it was a struggle for us to kind of get through. You do miss your mom and your dad, but that's not what's causing you to be upset.
Right now.
Like you're upset because you see the fire trucks and there's a fire drill and you're scared of the loud noises for the fire drill. And so I had to kind of like talk through with him. Yes, you do miss your dad, but that's not what you're really feeling right now.
Right
now. Trying to like help him work through that.
And like identify it.
Yes, because he didn't know. All he knows is I don't feel safe. When my dad is here, I do feel safe. I miss my dad.
Yeah.
But he kind of missed the other steps in between. And so that's a thing we do a lot in the classroom of helping children work through and label specific anxieties.
Emotions. Yeah. What you're actually trying to say.
Yes.
Yeah.
We do a lot of work with social emotional learning, especially in the preschool ages.
Yeah.
And I think I mentioned the book when we did books, Ruby Finds a Word.
Yeah, yeah.
One of my favorites. I literally just read it to my son, Jay, earlier this evening at the library.
Oh, really?
He was having a panicky day, so we read it at the library. But I love that one because it goes through and shows children they need to be talking about what worries them, and it makes it safe. That they know, like, you can talk about this and it's okay. Because sometimes you're so nervous, you don't want to say it. I know many times I've had that, even like with my friend or even my spouse, when I'm like, there's something I need to say, but I can't say it to you.
Yeah.
And so like, we'll text it. For me, like it's so much easier.
Text it.
But like when you're a kid, you don't have that.
Yeah.
And so you have to, the only way to get it out is to talk about it.
Right.
And so, it's important to have that outlet.
Yeah. One cool tip I saw, I think on like an Instagram reel where a mom, and this is not necessarily anxiety, but it could be like, I'm anxious to tell my parent this because I might get in trouble or something, is she said that she did it as a child and she's continued it with her own children, that they can say at any time, I need 2 minutes. And that means, okay, collect yourself, because in 2 minutes I'm going to come back and I'm probably going to say something that you're not going to be happy with me about.
Okay.
And she went on to say, the child thinks it's for them, but really it's for her, so that she can say, okay, my kid came off the school bus and said, I need 2 minutes. Maybe something happened at school. Maybe something happened on the bus. And it could go either way. It could be like, hey, I was getting picked on the bus, right? And that's hard to talk about. Or it could be like, hey, my teacher sent home a note because
there's
this
a
happened.
note in my backpack.
Right. So it could be either way. It could be like, I might get in trouble, or it might be, this is hard to talk about.
Yeah.
You know, which I validate a lot in my office. I'm like, I get it. Like, these things are hard to talk about.
Absolutely.
Especially when they're first coming into my office. I'm like, I'm a stranger.
Absolutely.
And I'm like, please tell me about your dead father. You know, I mean, like,
it's hard.
Yeah. We're the bullies at school or whatever it is.
So do you have any good do's and don'ts tips for when we are seeing anxiety?
Do I ever? So, yes. I guess we always say we'll start with the don'ts.
The don'ts.
So we end on the do's, the positives. And this one might be, some of these don'ts might be tempting, right? And even in my office, number one, don't reassure.
Stop and say that again. What?
Do not reassure, which is so hard. I want to reassure as a therapist.
I'm sorry.
It's okay. No, it's okay. But it only increases the worry. Okay. It only increases the anxiety, because then they think, well, my mom or the therapist or my teacher told me it would be okay, and now I feel better. So when I start to feel nervous again, I'm going to say, are you sure? Are you sure? Are you sure? And they're going to tell me, yes, it's okay.
And so then they're needing that external reassurance.
Instead of learning how to say, I don't feel good right now. And being able to have that language, I think I'm feeling anxious. This is an anxious thought. This is a worry that's in my head right now. And here's what I know I can do with it. Talking about it, for sure. Mm-hmm. You can do that. You can say, I'm feeling really anxious right now, or I'm worried about this test. I'm worried about having to do this, you know, Miss Brigid or whatever. But we don't want to be giving tons of reassurance.
So it's not necessarily like that you can't comfort them.
You can
you can do like the hugs and the comfort
and validate,
but you don't want their calmness to come from you.
Right.
You want it to come from them.
From them.
Okay.
Yeah.
All right. I get it. I was ready to fight you.
I know.
Saying don't reassure.
It's hard. It's hard.
All right. What else are we not doing?
Don't fix it too fast. Same premise, right? Because then they're relying on external things. An example of this, sleep experts, I might have said this, I think, in the sleep episode, suggest that you don't immediately give a child a nightlight if they're saying that they're afraid of the dark. Instead, you can kind of show them, hey, the room's the same when the lights are on, the lights are off. We can sit in the dark and play with flashlights, kind of make it fun, and just get them sit alone with them in the dark, with maybe in a dark room, during the day. So it's not just
not as
time.
Dark.
Yeah. And it's not okay, good night, and the lights are off and the door's closed and mommy's gone.
Yeah.
But kind of easing into it. So yeah, same thing is you want them to be able to learn that they can tolerate that distress, which is another hard one.
Not me over here thinking about how I have a nightlight in my kids' room and they have to sleep with the door open and the light has to be on. I think I've created little sleep monster.
How many times a week does a child end up in your bed?
7 out of 7 nights. So it's a lot.
So don't be like Brigid.
Don't.
And then the other one, I think this one is more acceptable in that people aren't going to be ready to fight me, but don't lie to appease.
Oh, please don't.
Yeah. Don't. And I think because my examples here are school shootings, death, things like that. I remember my cousin, she was 2 maybe. We were jumping on the trampoline and she bounced down and she said, Jenna, I'm going to die one day, right? And obviously, and if she was 2, I was 15. And I was like, oh my God, I don't want to tell her she's going to die. And I said, well, but she was already phrasing it that way. Mm-hmm. So I was like, yeah, one day in a long, 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 long time, right? You don't have to be yep, and it could be tomorrow, to a 2-year-old.
Right.
But, we know that life is short as adults. But I was like, yeah, in a long, 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 long time. And she was like, mommy's going to die one day, right? And I was like, yep, and in a long, long time. And so something like that, right? We might want to be like, oh, honey, don't worry about that. Don't think about that. No, you're not going to die. You're safe.
Or saying oh, that will never happen.
That will never happen.
Don't say that.
I will never leave you.
Right.
Well, you probably are eventually.
At some point.
Hopefully they're 68. Yes. But, So yeah, same thing with school shootings. That would not happen at your school. We want to. Of course you want to say, hey, class, that would never happen here. It would never happen in our classroom. You're safe here.
So
Yeah,
you don't have to worry about it.
Yeah.
Is the end of that. It
Right.
would never happen here.
So
don't worry about it.
Yeah. Because unfortunately, we know it does happen.
Yep.
And yes, we want our kids to feel safe. And we did a post on our social media about that too, with the most recent school shooting.
Yes.
You know, that's why we do these drills. Yeah, you're right.
Mhm.
We don't want to fire. Fires can feel scary. That's why we practice. We do
Right.
fire drills to get out. So we know what to do if it happens.
Yeah.
You can say things like, it's not likely to happen. Most,
That's true.
it's rare,
Yeah.
but we do fire drills because if it happens, now we know what to do. We have a plan.
Yes, indeed.
So.
All right. So what are we doing?
Doing.
Not don'ting. What are we doing?
Offer tangible tools, right? So not just that reassurance, it's okay, you're safe, it's fine, but tangible tools like, okay, I can see you're really anxious right now. We can do some deep breathing together. I like to play the color game. So like, hey, can you find all the blue things in the room right now? What about squares? Do you see any squares in here? Because then they're distracted, they're looking around, they're using their senses. The way that oftentimes adults, I'm sure you've heard of 5, 4, 3, 2, 1.
Yes, like 5 things what you can see or
feel.
Yeah.
Yeah. Absolutely. And so if you want to do that, oh hey, like what's your sweater looks fuzzy. What is that? So that you're almost distracting them, but also you're really grounding them.
Okay.
But in a kid
Right.
way. Validate the emotion and then teach acceptance. So if that makes sense, you're worried right now. That makes sense. You're worried about your class presentation tomorrow. You might still feel nervous tomorrow when you need to do it, and that's okay. You can still do it, right? You can still do things. You can do things scared. You can do hard things, right? Giving them those little mantras that they can do the thing even if they still feel anxious or
they
worried.
don't have to completely
Overcome
eliminate that emotion.
Yeah.
Yes.
I don't need to wait until I'm not scared anymore to jump in the deep end.
Right.
I can do it and feel nervous about doing it.
I think that's a thing that I want to say like superheroes talk about in like kid shows a lot where
really?
It's being brave doesn't mean you're not scared. It means you're scared, but you do it anyway.
You're doing it.
And you can still do it. You can be afraid and get these things done.
And do it.
Yeah.
Yeah. It's a good message for sure.
Absolutely.
And then offering plenty of like resources and just almost like preventatively. Plenty of like physical movement because we know that that's going to help with like the buildup of stress and anxiety. Time to decompress. We all know some of those kiddos that need a minute when they get home from school.
Oh, absolutely.
So if that's your kiddo, that's fine. Give them that minute.
Yes.
Or in the classroom, I'm sure you see that. Like,
oh, for sure.
Our friend over there needs to hang out before they join circle time, which is fine. Expressive means letting them color and draw your worry, make a worry monster.
Worry monster is a big one.
Yeah. Make it out of Legos, make it out of, I've seen tissue boxes and then they can eat them.
Oh, that's fun.
They can, you can stick it in, they can eat it. Sensory activities, like all of those things are going to, again, be grounding, engaging the senses. So that can be really regulating as well. For us too. I think we talked about that.
Absolutely. Especially like we know, going back to you said like the physical exertion.
Yeah.
We all know from Legally Blonde, exercise gives you endorphins and endorphins make you happy.
And happy people just don't kill people.
Exactly. So yes, even for children, that physical exercise is valuable. It's a valuable release of that worry.
Yeah, absolutely.
Definitely.
Do you have any other do's and don'ts that you see in the classroom or with your own kids?
No, I think that's pretty good. I want to say like the biggest one in the classroom is definitely validating.
Yeah.
Validating that they can feel that way and still
do whatever and do your work and do.
You can feel nervous and still accomplish things and giving them those tools to kind of work through that. I also really want to emphasize that like if it's enough as a parent looking at your own child, if it's enough that you're saying, I don't know, does my child have anxiety? Maybe they could. Then that's already enough. Go ahead and get them screened for it. Why not?
Yeah, why not?
The worst is going to be is like a doctor visit for you and they'll screen them and say, no, I think it's probably okay. Maybe just try some tips at home.
Right.
Or maybe you could get some help from a professional who knows how to kind of deal with children.
Right. Absolutely.
And another follow-up that I hear a lot especially from our really youngs, is that parents say, oh, well, they're only 3. They're too young for therapy. So Jenna, is 3 too young for therapy?
It is not. I personally have had 2-year-olds in therapy multiple times, my whole internship. And in addition to that, when I was a receptionist at a private practice, I saw an 18-month-old client come in. 18 months!
Wow.
18 months old.
So I guess what you're saying is there is no such thing as too young for therapy.
You're never too young. You're never too old.
Okay, good to know. So if your child is dealing with it, or if you as the parent are dealing with it.
Absolutely.
Or if you as the grandparent are dealing with it.
Yep.
Whomever, teacher who's been in the classroom a long time.
Mm-hmm.
We all have these anxieties. And I think, Jenna, you kind of gave us the tip that if it's starting to impact
you,
the other parts of your life,
yeah,
then it's time to do something about it, whether that's therapy, talking to a friend, whatever it is.
Right.
Something to keep yourself going.
Absolutely. Yep. And it doesn't have to be diagnosable even to come to therapy.
Right.
Technically, when we're using insurance, we need to give a diagnosis, which that's a whole other episode.
Yeah, really.
But yeah, I mean, it's what we can call like quote unquote adjustment disorder, which means he's feeling anxious because he started kindergarten this year. She's feeling anxious because this happened. Mm-hmm. She's, down and depressed because whatever, which makes sense. Yeah, obviously that makes a lot of sense. You're anxious about starting high school or middle school or kindergarten or whatever it might be.
Absolutely.
Or you moved to a new house.
And not only that, but it doesn't have to be those big things.
No.
It can be those little small things too. I know my kiddo, my Jay, is almost certainly probably diagnosable with anxiety. He's the one who's in my bed every night. He struggles at drop off. Just today we were walking up the stairs after school and there were older kids in the hallway not doing anything. They're getting ready. They're leaving class. They were just at PE and they're going back to their room, minding their own business. As soon as we get up the stairs, dead stop in his tracks and hiding behind me because those other children that he didn't know were present.
Yeah.
And like that was enough. And so, yeah, that was impacting him because the reason we went upstairs was that he had to go potty. But suddenly he stopped and he couldn't go back in there because he knew they were there. And he's like, I don't have to go. And wanted to just turn around and go right back where he came from.
Yeah.
And so like you see those moments of fear over anything. It wasn't a big thing.
Something small.
He didn't switch schools. He didn't, nothing big happened.
Yeah.
There were just children standing in the hallway and that was enough.
Yeah.
So you don't have to think, well, we didn't move. Nobody's died. Nothing big has happened. It doesn't have to be.
It can be
anything that's causing your child anxiety is enough reason to help them, right?
Absolutely.
Whether you do the research and help them or you get outside help, whatever it is.
Absolutely. Yeah.
But they need us. We need to not ignore anxiety in children.
Yeah.
Because it grows into big anxieties in big people.
It grows into bigger things.
Yep.
Yeah. Then you're an adult who does have agoraphobia.
Yes.
So, yeah, check out our social media. All of last week, we posted about this with more tips, more mindfulness skills. Go back and listen to our book episode. We have some good things in there for coping skills and anxiety as well.
Absolutely.
All right. Till next week.
Thanks for listening.
Bye.